but it is now my pleasure and honor and privilege to announce the first Resolve Award for this evening in the category of finance, and it is presented to the Ambassador Shankar Das Bairagi, Nepal Permanent Representative of Nepal to the UN in Geneva, WTO, and other international organizations. This Resolve Award recognizes Nepal for the innovative use of financing to remove barriers to utilization of safe delivery services for women and communities. The financial incentives were created, as you will hear later, in a very clever manner to overcome cultural barriers about institutional births and decrease maternal mortality. Please join me in welcoming the Ambassador to the podium.
Thank you. Thank you very much. Good evening, ladies and gentlemen, honorable ministers, excellencies, distinguished delegates, ladies and gentlemen. First of all, I wish to convey sincere apology from the Minister of Health of Nepal, who is unable to attend this very important ceremony this evening. I wish to thank Ambassador King, good friend, Aspen Global Health and Development, and the World Health Organization for inviting us here this evening. It's my pleasure to receive, on behalf of the Government of Nepal, the Resolve Award, and thank the Global Leaders Council for Reproductive Health for selecting Nepal for this important award. I would like to take this opportunity to commend the United States' strong commitment to the global health agenda and its valuable contribution to improving and saving lives globally, including through the Global Health Initiative, GHI, with its principal focus on the health of women, newborns, and children. It's a matter of satisfaction that Nepal has been recognized internationally for many of its innovative programs and policy efforts aimed at improving maternal and neonatal health. Nepal has accepted the universal recognition of health, people's basic right, and has been making efforts to increase the access of the people to health services with appropriate policy, legal, and institutional reform in the health sector, together with increased resource allocation. We introduced the Safe Delivery Incentive Program in 2005 with the provision of cash incentives to encourage women to deliver in public health facilities and the provision of cash incentives to skilled care providers. This has helped alleviate the financial burden, and as a result, delivery by skilled birth attendants and institutional delivery has increased. The evolution in 2009 of all user fees for delivery care in public health facilities help further expand safe delivery care nationwide and contribute to the realization of the fundamental rights to reproductive health as enshrined in the Nepal's interim constitution. This motivated some of the private hospitals and medical colleges also to contribute to the implementation of the initiative. The government initiated yet another measure to reduce maternal mortality rate by introducing free of cost maternity services through a national program famously known as the Ama Suraksha Program, literally in English, Mother Safety Program. The Ama program has three basic components: free institutional deliveries, safe delivery incentive program, cash incentive to women who complete 4 ALC visit. I share with pleasure that the AMA program has substantially benefited poor and marginalized groups. The program has remained important in strengthening focus on the quality of maternal care, greater geographical coverage, equal opportunities to access quality services, and on sustained commitment towards ensuring skilled care during pregnancy. With these measures, Nepal has been able to significantly reduce the high rates of maternal deaths and make progress towards achieving the MDG 5. Nepal today accepts the Resolve Award with honor and a sense of additional responsibility to work for improving the health of women and children in Nepal. I thank Aspen Global Health and Development once again for recognizing Nepal's efforts in promoting maternal health. Nepal stands today at a critical juncture of political and socio-economic transformation as we conclude the peace process and are set to promulgate a new democratic republican constitution ensuring the fundamental rights of our people, including the right to health. We firmly believe that economic and social agendas have a great bearing on the success of political transformation. We would like to renew our call on the development partners, including the United States, to continue and scale up its support in these critical times to enable Nepal to achieve vital health-related goals. Before I conclude, I would like to take this opportunity to thank you, WHO representative. I haven't seen here Nepal for their continued support in Nepal. I thank you once again for